All. This is Dr. Mobeen Sayed from drbeen.com. This is the second show today. Welcome. And today I saw that Jenna is first, Steve is second. So Jenna, hello. Steve, hello. Jim from Iowa. Kerry Lynn, hi. Jim. Jim says I'm first, so fine. Steve says Jenna was first. So yes, Jenna was first. Kamran is here as well. So quick update for KHW says fourth. So you're fourth on Periscope? Wow. Line guy says hello. Anthony says hola. Anthony, how are you doing? And then Cynthia from Armstrong, hello from Richmond, California. Deborah, hello. Sports card says, do you recommend long haulers taking the vaccine? I have done this discussion before as well, so let's talk about that for a second. Long haulers. We talked about long haulers last week. I think there is still one more topic to be discussed in long hauling, and that is the persistent virus. The reason I did not pick it up today was that because of the audit discussions today, the whole day in the morning I was busy. Secondly, I'm not well, so I didn't have a lot of time. I actually took some time off and I lied down. That didn't give me enough time to prepare. So I didn't want to do a bad job of talking about the viral persistence, so I didn't take it up. But I have to talk about that. So sports card, once again, with that context, let me explain the answer in two ways. If there is viral persistence, and viral persistence means our immune system has somehow not been able to take care of the virus. It baffles me that how would vaccine, which is a tiny bit of spike protein, poke our immune system enough to go take care of the virus, while the actual presence of the virus did not cause the immune system to take care of it. So I believe that in the case of a persistent virus, giving the vaccine would not do anything. It's just another maybe 2 minute worth of replication of a virus. If the virus is not present and the immune system has become dysregulated, for example, there are mutations in the mast cells, or there are mutations in the monocytes, or there are other issues with the immune system's dysregulation, then a vaccine is going to do nothing. It's only trigger the immune system once more. An immune system luckily will not be triggered like a cytokine storm. It would just be bothered for some more days, and that's about it. So in my opinion, a long hauler will not benefit from vaccine from a mechanism point of view. So this is my opinion from mechanism. The data is not there yet to be able to say long haulers were given the vaccine and 80% responded. That data is not there. So let's see when the data comes in to see how to match that. Okay, so quick update for a couple of things. Number one, the audit. So we had a meeting, I think more than an hour long, very good meeting. Auditors were actually very, very nice. They said that, hey, we had the complaint, so it is our job that we look at what you're doing and what you're teaching and if that is compliant and all that. And they said there are a few things, for example, some forms to be filled and submitted and that. And they said, we are comfortable, please provide us those forms, sign them, and we'll move to the next step. And it looks like it's going to be okay. The forms that they were asking for are generally the forms that we should be submitting. We had submitted them, and they said these were a few, they were not from this year, they were from last year. So they said, please refresh those forms. So I think that was not bad. In terms of the videos, the content in there, their question was that the content that you have, are you updating it according to the latest needs? And would you remove those pieces of contents that may not be relevant or not accurate for COVID after more research is done? It is fine that those pieces of content are up now, but as the more clarity is being received, would you in the next year or after some months, would you remove them And I said, yes, if there is something which is, let's say there is therapy A, and we thought at some point, the research thought it is useful. And then 2 months later from now, researchers come back and they say the therapy A is useless, and we all agree on that, then yes, we'll remove that. And they were fine with that as well. So I think we will be okay. Um, the the thing that I was more worried about was that this would be probably a punitive response to say, you know what, you cannot function in this capacity anymore. So stop that part of your business, and then go do something. And I would have a, I will have to figure out how to make my bread and butter. And so I think that part is not that much at risk. So that is the good news. Thank you very much for everyone's care and consultation. It is still the process going on, but the needs that they have are minor. Plus, this is fair to say that, hey, if there is some content that need, for example, I'll give you an example of a content that needs to be refreshed, and we have refreshed. Remember, I think in 2018, the definition of hypertension changed. So the where do you declare that this patient is hypertensive and start managing them? That definition, that those blood pressure points were changed. And so we took down those videos that were saying the points from before, and we would then upload the videos which are in accordance with the new points. That is fine. Similarly, let's say yesterday we said for COVID, something X will work, and then tomorrow it is proved it will not work. And if we think it is something that is also true, then we would take it down. If we think it is not true, then we can leave it up, but then we can not offer it for professionals to say, use this for your clinical practice. So these were the kind of things, a very decent environment, good discussion, and lots of good guidance to say, here you are not compliant, and so please comply. So that was in the audit. We are still in that process. Our team would now work on various changes. There are some changes on our site as well. There are some changes in the conflict of interest as well. For example, they wanted to know if I have any influence for any big pharma or any device company or any other groups who may have any interest in the way we teach or what we teach. And of course, we don't have it. So that would be simple for me to sign that and give it to them. So all of that was fine. So this is the report on audit. Thank you very much once again for your help and care and suggestions. Now, the second part is my health part. So as you saw yesterday, till yesterday, I was totally fine. I'm fine today as well, but I want to show you something. So yesterday, I was fine. I was talking. I was continuing. I did feel a little tired near the end of the discussions yesterday, but generally I was fine. So I thought, and I received my result as well. So I thought, good. Why not I leave ivermectin, and see what happens. So I had taken ivermectin 3 days for full doses. And remember, originally ivermectin had been taken 1 day and the day 3, and then for the whole month, nothing. And my practice has been for active infection to give ivermectin daily. So I decided for myself to stop that yesterday to see what happens. Was it really working? Was it really COVID? So here is what happened today. You may actually still hear, once again, slightly nasally sound from me. So I did develop congestion in my nose once more. I did develop some sore throat once more. I actually developed some mild bronchitis as well, that when I do, I can actually feel that there is phlegm developing. That means there is a possibility of the lower respiratory tracts becoming involved if I'm not taking care of it. And this was not the case yesterday. Also today, I saw that my oxygen saturation fluctuated between 95 to 98, while for the last 3 days, it stayed stable at 98. I felt a little tired today as well. And enough tired that I went up after the audit meetings and those, and I wanted to lie down. And I wanted to prepare for the lectures. I wanted to work, but the the feeling to go lie down was more strong. So I actually went and lied down. So then I called my cool bean doctors as well, and I discussed what I'm feeling. And I said, look, to me, it seems like very strongly that ivermectin is helping. And when I was taking ivermectin, I was stable. And as I skipped a dose, I am seeing this difference. So that set of doctors, here was their opinions back to me. Number one, good news is they said that yes, your PCR is negative, but it still seems like your symptoms are that of COVID. So they said we would put you in the mild case of COVID, but we would still put you in COVID. And I don't blame them, because from a positive predictive value, which we've done clinically, if a person has those symptoms which are going around, then even if the test says no, you should still manage in that way. So they said, assume you have COVID. That's one. Second, they said it is good that you are not deteriorating fast. What they're seeing is that patients who are mild, they can keep lingering on the mild symptoms for a long time. Even after recovering, they can become long haulers. But the patients who become rapidly deteriorating, they deteriorate very fast. And so they don't go on for 3 days without any issues with the oxygenation or being able to articulate the way I am. I have seen my patients as well that when I speak with them, if they are actively infected and they are deteriorating, they cannot have one complete sentence with correct intonations and with correct stresses in it without feeling, without stopping, and without catching their breath. So, of course, as you can hear me, we do not have that so far. And again, touch wood, I hope it does not go to that level. And so they said, we don't feel that you're progressing, deteriorating, and we don't think you would deteriorate. So that's two. Thirdly, some of the doctors said, start ivermectin again. And some of the doctors said, okay, why don't we skip ivermectin for one more day just to see if you're just recovering on your own, or would you need ivermectin? So wait till tomorrow. So in the name of science, I agreed to wait till tomorrow without ivermectin. That will mean 2 days without ivermectin. I didn't have fever, but I felt feverish. So what happens is when you are fatigued and when you are weak, one of the feeling is that the patient thinks they have fever. So they feel feverish, but they actually don't have fever. So I don't have fever, which is also a good sign that fourth day into whatever symptoms, I don't have fever. Normally, patients who are going to continue or who are going to deteriorate, they start developing fever. So this is the situation. Generally, I am fine. What I did was I had been taking anti-inflammatory and the supplements and the ivermectin. Supplements I just took about an hour ago. That was what I was doing every day. Ibuprofen, I did take morning. I did take it now as well. But it is very interesting that how ivermectin was like a magic. When I was taking ivermectin, it just cleared my whole system as if I was normal. And I missed it yesterday. I'm going to miss it again today. And I already have that feeling of, I think you may be able to hear it in my sound, that I have some of that, congestion that you can hear. So this is the update. I would not go on for a longer time today just because I do feel a little tired. I want to sleep. That is a feeling that I continue to get. Luckily, I'm able to walk around, do my things, but I'm not in that state where I can call myself 100%. So let's see now what we have here. Christine says nasally, yes. So I feel that congestion. I did have slightly runny nose during the day today, but it has now, I think after anti-inflammatories, it is a little more taken care of. Siddhartha says, hope you take good rest. Yes, definitely. There is a good news, and that good news is that I'm not deteriorating fast. And then there is an interesting thing that when I stopped ivermectin, the symptoms came back. And when I was taking ivermectin, it didn't to me, it seemed like I don't have the problem. And why am I just saying I'm sick? But as soon as I stopped ivermectin, last evening was fine, but the morning till now, you can actually you can actually hear those congestions. So who is auditing you? Yes, so we have governing agencies who have an oversight about the kind of content that we put out for professionals. And somebody within our own, not my team, but some of our customers, they complained. And again, their complaint is not unfounded as well. It's just that we need to prove that we are not influenced by anyone, and which is fine. We can prove that. Jody says, take your medicine. Don't be stubborn. I would. So Jody, how about just for today, if I don't take ivermectin? I actually want to see that by myself as well, that will ivermectin do make a difference? If I die in this process, you can say he was doing an experiment and he proved it for once for all that ivermectin works. But I wanted to check it. And there is a clear difference, like night and day, that the time I was taking ivermectin. And what surprised me is this, that ivermectin's half-life is 18 hours. And I skipped it yesterday. Remember the first day I took it, that was about 7 or 8 in the evening. So similar time frame, I skipped it yesterday, and today I already have the symptoms back. And these came back about 4 or 5 hours ago. That means because I was taking the lower end of the therapeutic dose, 150 microgram per kilogram body weight, that is the lower end. So as soon as I skipped it, it has already dipped below the efficacy. And so my symptoms are back. So it didn't even wait for 18 hours and it just went down. Steve says, only Dr. Jekyll's experiment, and don't be Jekyll. Okay, fine. So you believe that I should take ivermectin today and not skip it? I think you will want to take the ivermectin before the night is over. So should I just then take it at that 8 o'clock? So Mr. J says, how are you monitoring your oxygen? So I'm keeping we have a couple of these oximeters. So I'm just keeping it with me all the time. And I just keep looking at it. So let's see right now. So if you see here, 98, it is interesting that you see here 98 and 77. So it is 98 during the 3 or 4 in the afternoon today. It was fluctuating between, I saw 93, I saw 95, I saw 97, I saw 96. It was not touching 98. And so that concerned me a little bit. And then I talked with the doctors as well, other doctors as well. At the end of the day, it was funny that I was talking with the doctors and they were saying, we actually practice what you have been teaching. So I said, well, I cannot practice it on myself. You tell me what's going on. So that was so funny. Sepa Steve says, just read about protein that is effective against COVID susceptibility severity. It's known as OAS1. So have you heard of this protein? Can you research it? No, I have not, but let me take it down. OAS1. Cool. I took down that note. Janet says a broad antiviral and immunomodulator. Yeah, so in the last talk, we just went over all the functions. Denise says, just take it. Fine. So I will take it. After this discussion, I will take ivermectin. So this is a good question. Mr. Cool says, when does COVID reach the lungs? So normally it takes 2-3 days to go towards the lungs. But once it is in the lungs, and then it progresses very fast, and within 24 to 48 hours it kind of brings a person to a point where they have to be in the hospital. So considering myself, I didn't see, so even now when I did this 98, one thing that I did, which actually many non-medical folks said don't do it, but medical folks understood, was that I kept taking ibuprofen or anti-inflammatories. I didn't take steroids, but I did take anti-inflammatory. And my logic was that even if the virus is doing something, if I keep my inflammatory system in check, let the virus do, if it wants to do some damage, that is okay, as long as the immune system and inflammatory system does not react badly. So if I can hone them in, it should be okay. So one thing that I have been doing is I did not let the inflammatory system get out of hand. So again, this is not a prescription for anyone, but this is what I am doing. I am taking 1000 milligram of ibuprofen in the morning and in the evening. Remember that 1000 ibuprofen was by that French health minister's tweet, is a contraindicated thing. Don't take it. It is hurtful. It actually is very, very productive. And again, because I was doing it on myself, I was more comfortable than to try it on somebody else. Rajesh says, if I take ivermectin, if oxygen goes below 90. So I think that I would not take a risk of going below 93. And if there is any chance that my oxygen is dropping, then I would take ivermectin just before that, because oxygen going below 93 would actually mean enough lung damage. The point is not to allow that damage to occur if possible. And so ivermectin and the other things have to be taken before, so it doesn't happen. Zigzag says, how is your taste and smell? So very, very good question. And I kept looking at it the whole day. So right now, very good smell and very good taste. So on this one, the funny thing is, so of course, in our home, we are 3 people, myself, my wife, and my son. And of course, we got exposed together. So my wife for 2-3 days also has runny nose, and she's also taking ivermectin, and she's also taking care of herself. But yesterday, she kept saying, while cooking, she kept saying, what's wrong with my taste? Why is it so bitter? What's going on? Why can I not taste this thing? So she then called me and she said, can you taste this? I cannot taste this. And it looks like I really cooked something really bad. And I tasted it and it was fine. And then I said, looks like you have COVID and your sense of smell is gone. So I said, can you smell? And she said, no. So I said, okay, can you smell something else? And she said, no. And she would just keep going around. But then she said, because my nose is running, normally when my nose is running, I cannot smell. So then we asked her to, can you please go and make your nose a little more clear? Then she did that. And then she came back and she smelled, and she was smelling fine. So there was a tiny bit of a issue yesterday with this sense of smell. So good question from the Cool Bean here. Paul is saying, looking to see better symptom report tomorrow. Absolutely. Don't have fever though. Correct, Barbara. So this is the important thing, that don't let it go to the state where it causes enough damage. So I am going to take ivermectin today. I think you are correct. The whole community is correct. So monoclonal antibody question. So Denise, the altered taste is again related to the smell. There is no direct effect on these taste buds or the taste nerves. It is the smell modulation that causes taste change. So James, why don't you take the monoclonal antibodies? Because they said that we're not going to give you monoclonal antibodies. So Regeneron only if I'm in ICU, and the bamlanivimab only if I fulfill the criteria. and I do not, from age or from comorbidities, I do not fulfill any of the criterias. Um, Neither is my age in that bracket, and nor do I have no comorbidities. So, good morning. B12 says France is making me nervous. Not that the virus can replicate without care. I would take it. Soon after this, I'll take it. My apologies for experimenting. So that is what I'm saying, Salon, that ibuprofen is an anti-inflammatory. There is no study other than French minister's tweet, for which I had asked him that, hey, do you have some data that we can look at? Other than that tweet, there is no proof that ibuprofen is not good. And so I took ibuprofen. That is correct. See, I'm congested. So Regeneron is not doing well with the new variants. Yeah. Barbara says, which criteria? Flying on the Air Force One? Yes. So if flying on the Air Force One, then everything is available every time. Otherwise, not until you fulfill those criteria. This is a horrible situation that I think in the history books, this will be written that a pandemic, when that arrived, those countries that were developed and had rules and regulation got themselves stuck, while those that had more flexible rules and regulations were able to evade and escape this. I am really shocked at the way, meaning calling my own doctor. And so when I called, other than my own doctor, when I talk with the Cool Bean doctors, they say that we are practicing what either IMAS plus or what you are saying, or a combination of those. So when I talk with them, they say, well, you know what to do. My own doctor kept telling me, it is like cold. Don't you even worry about it. It is just going to go away. Just quarantine yourself. Just don't do anything. Take symptomatic treatments. And if your breathing issue occurs and saturation drops, then go to the hospital, and then they know what to do there. So he kept saying it is cold. It is a common cold. This is how bad it is. And then I kept saying, I said, hey, so do you give ivermectin? And he said, no, we don't give ivermectin here. Then I said, do you give bamlanivimab? And he said, even for bamlanivimab. And I said, this is an outpatient medicine. And he said, no, I don't do it here. So if you needed it, you'll have to go to emergency. So just weird. And I am a doctor who's been teaching this for now whole year. Imagine those who are not doctors, who are not teaching this, who are not fully aware of it. When they want help, I think they would not get any help. This is horrible. Yes, I'm doing gargles. Uh, um, 8 Dylan says, my grandparents are getting the Pfizer vaccine next week, and I am worried about how they might react. Is there anything that they can take that might help with the side effects? Would IMAS Plus work? So IMAS Plus would reduce inflammation. Any other anti-inflammatories would help as well. Antihistamines would help as well. But this I cannot offer to any of the persons here. This is something that you should talk with your doctors to see, because they may have comorbidities and they may not be able to use these things that I'm talking about, and these may be harmful for them. So please ask the doctor that, should we take some anti-inflammatory? So Kamran says, a friend called me and said, before you get the vaccine, get some ice cream. You will not get fever and sight will not hurt. I laughed so hard, but thought of sharing it here. Absolutely. Did he say to apply the ice cream on the deltoid muscle as well, or eat it? He may mean to put it on the deltoid muscle. Have you seen the Merck and J&J news? No. What is the news? I'm sighing so very deeply. Thank you, Barbara. Sorry, I was just trying to make sure that I study the effect of ivermectin. Janet says, an unholy marriage. Is that the J&J and Merck? Janet says, Island Man, it's from inflammation, need to control with diet. Janet, how are you doing? Um, Tube says, that's an amazing story, Dr. Bean. Thank you. Um, wow, that is interesting. Merck is supposed to manufacture the J&J vaccine. Well, that is why they were so upset about ivermectin. Amy, I did not check the CT of my. I actually thought of going and checking that, but I didn't do it either. Today, I was just all wrapped up in the audit and the discussions and the preparations, and then after the audit, sitting with the team to plan for the compliance things that we need to do. So Merck will make J&J. That is why Merck was so much upset about ivermectin. Emily says, I have had a tingling sensation on my tongue for 11 months post-COVID. Taste is also not fully back. Could there be a correlation? Possible. I mean, if you're saying that this happened after the COVID, then of course there has to be something. Now, is that an inflammatory system, inflammation within the brain, or is it something out here? So do me a favor. Number one, if you can get ivermectin, and I have shared the numbers for ivermectin, you can see them on flccc.net as well. I have done video where, so try to see if you can get ivermectin, number one. Number two, do the neck massages or lymphatic massages and neck pumps, which are things like this, and the spinal cord pumps, and then see if that changes the situation. If that changes it, that means there is some inflammatory situation state inside the brain or the brain fluids. But if that doesn't change it, that means it is outside, and then ivermectin might change it, which means anti-inflammatory would help. So Dam says, is any treatment curing or getting long haulers better? So what I'm seeing is that most of the long haulers gradually become okay. In the early stages, I have become a big proponent of aggressively treating. So look, while I'm saying it, I stopped my own ivermectin yesterday. So I can actually become a long hauler if I don't aggressively treat myself. So I want to give you both balanced view that when I wanted to look at, I wanted to understand if ivermectin was really helping or not. This is Luffy and Kyrie running around. But aggressive early treatment should actually not allow a person to enter the long haul state. And what I've seen is that a therapy of steroid for a week, 6 days, low dose therapy also helps remove the long haul outcome. Afterwards, there are many long haulers here as well in this chat that have been going through various management experiments, I would say, and some are improving, some are still figuring it out. So can we say there is a cure? I know in the early stages, steroids are very, very helpful. All of my patients have been cured or not entered the long haul due to that. Paul says, we are about 25% effective in hitting the like button. So Samantha says, I'm 35 days in it. Is it too late? No. So one of my patients had one low dose steroid therapy near the end of his original COVID infection, and he almost had died. He was the one with the 86 and really in a bad state. Then the low dose steroid therapy conjoined with the other therapy helped him. But 2.5 months later, he's once again complained of some of the symptoms, and I gave him once again the low dose therapy, and then He recovered and is fine till to date. So no, it is not late. So Debbie had actually asked me to talk about this as well. I am over long haul, cured by interferon inducer, siloferon, and artesunate. And Debbie had, I know that you had asked me to talk about it, and I just didn't find time. So we will talk about this as well. So here we have Debbie, and she is saying that she was a long hauler, and this management has helped her. It is curative for her. So Debbie, thank you for sharing. James says, what do you think about J&J? So remember we talked about it, yesterday? It is weird that they have strange efficacy. I like one shot, but I am kind of bothered by their efficacy. Today, I wanted to compare the vaccine side effects and the adverse events, but today I just was so wrapped up with the what was that? The audit, and then I was just so tired that I didn't. Simple Steve said, we are going for our second dose of the Moderna vaccine on March 27th. Good. Hopefully we'll be protected after the date. Yes, so please know 7 days or 14 days after the second dose. B12, he said he thought he got it at the coffee shop. Yeah, so that is the only place I go. Yes, ivermectin, dinner, and sleep, yes. So we'll stop in another 7 minutes. Simple Garden says, I only consider cured after 30 days with C19. It always returns after you start to feel good for a week or two. Samantha is saying, well, wasn't this the lowest effectiveness though? The steroids? Yes. So I keep the steroid low dose and then just try to modulate the immune system. Roberto says, do not get ivermectin, fluvoxamine, and everything you already know you have to. Yes, so I will take ivermectin right now, and I think I'll get my fluvoxamine tomorrow. So Jody, painting. Yes. So Mr. J says, do you sanitize takeout before consuming? That is coffee cup and lid. Yes. So we have a protocol that when we bring the coffee cup, we kind of put the sanitizers on our hand and we kind of apply it on the cup. Then we take the lid and we spray the sanitizer and then we clean it all. So there is a lot that goes into trying to make sure it is fine. Plus the Starbucks where we go, the staff is already vaccinated, being essential workers, but still it is an open place where other people are coming as well. So it can actually be in place for transmission. So I just saw this. Texas says, send my coffee protocol to your website, but they didn't pass. Drive through, hot coffee, gloves, clean cup to decant. Okay. Okay, thank you. James says, do you think that in a few months they will withdraw approval of J&J? No, I think they would continue with it. It's just that I am disappointed at their adverse effects. The only thing because of which I cannot talk yet is I need to understand Pfizer and Moderna's concrete numbers in terms of death and adverse effects and compare them to this one to be able to say how good or bad this is. Because I haven't done that exact comparison, I don't want to just badmouth J&J. But to me, I am not a fan of J&J now. I was. Remember I said, one shot, let's end the pandemic. but I'm looking at the efficacy and it's not that great. It is interesting. Somebody had put a comment yesterday that isn't it true that other vaccines, one doses, also have a similar effect like J&J? And that is true. So maybe J&J can have a two-shot thing, and that would work better. So Christine says, I read that the AstraZeneca vaccine has a 77% higher rate of serious adverse events than the Pfizer. Is that true? How can we track the adverse events of each vaccine? I think the data is available. Some of that is available in trials too. I was going to pull that together and create a table and share that with the cool beans. It says, you just saw my excuse for today. Janet says, meet you an ivermectin man at Dr. Bean's driveway and make him hop into bed in 6 minutes. I'm boarding the jet now. Can I come along in the jet as well and we go have fun? France says, please listen to Samina's advice. So let's see what is Samina's advice. I'm almost, let's stop in a second. One of the doctors, so Samina says, please take homemade masala in hot water, including ginger. Will do. Will do. One of the doctors told me today, she said, you're not teaching, you're not doing anything, you're just going to bed and not getting up till you're well. And I said, I can't not do this. I promised her, I said, just 10 minutes. But here we are. So, Samina, do you mean Joshanda type thing? Okay, cool. So time's up for me. I think I should go. Cool. So can you help me edit and fix my college-age son's accounting resume? Oh my, please suspend your talks to get well. Thank you. Thank you. So, all right. Good night. Thank you very much. Please like, subscribe, and share. There is a link in the description if you would like to support this work. There is another link if you wanted to be a patron, and there is a link if you wanted to buy me a coffee. So thank you very much for your time. Tomorrow, once again, we'll do a smaller discussion about ivermectin and variants, and then we'll do some chit chat. Please stay safe and well, and I would just go take my medicines and then dinner and rest. Thank you very much. Have a good day.